Adolescents have been put on the national agenda because of several factors. One is because of access to antiretroviral drugs. These are children who are born when drugs were not available, but drugs are now available, and most of them have lived beyond their 5th birthday. They are now relating to other adolescents, and it is just important that they know how to protect themselves from new infection, but also to protect those they relate with. Secondly, Namibia is highly committed to HIV prevention and also youth agenda. And it is partners like the government, USAID, that we work with to ensure that we support the Teens Club, where adolescents have a chance to share some of their personal experiences. Stigma on HIV remains very high, even in high settings like Namibia. And it's through Teens Club where we engage with adolescents to tell their stories that has also made it a national agenda. UNICEF champions integrated services as a service delivery for adolescents because we believe that it provides adolescents a comprehensive service whereby they're able to access not only doctors, nurses, but they're also able to access counselors and also access peers. This is very important for their psychosocial support because they feel much comfortable through Teens Club, where they're able to engage with similar young people who have the same challenges. So it's through this integrated approach that we feel that we are able to provide adolescents a holistic service that they require. The success of Teens Club, to me, I can attribute it to adolescents themselves. They own Teens Club. They determine the content, the services, the approaches that are being used. What we do as UNICEF is to make sure that we listen carefully to them. And it is through that we try to give them a package that addresses their needs. Secondly, the government is very committed to the cause for adolescents. The Ministry of Health and Social Services, the minister himself is a champion of HIV prevention, a champion of care, support, and treatment. And also partners like civil society, the UN agencies, our sister agency like UNFPA, WHO, and UNAIDS are all committed to seeing a Namibia free of HIV through AIDS-free generation. I would also like to say that another factor that has also contributed to the success of Teens Club is because of the support that these young people get from significant others around them, the communities where they work. Stigma is still high, but what we've done as UNICEF is to conduct social mobilization by encouraging parents, teachers, and other members of the communities about the roles of Teens Club. So the ownership is there, and once you have ownership, you can't go wrong. It is true that adolescents living with HIV are still being left behind, but they are left behind because of several factors. Distance to services is one of them, and we are working with the government to ensure that we take services to adolescents. For example, the Teens Clubs in various regions is one way of ensuring that we don't leave those who are infected or affected by HIV. Another thing that we are doing to ensure that adolescents are not left behind is just engaging with adolescents, empowering them to be champions particularly those who are benefiting from antiretroviral drugs and are able to tell their stories. These are our champions in terms of convincing others that even if you have HIV, you can still lead a productive life. What it will take to change this is commitment to the SDGs, Sustainable Development Goals, and Agenda 2063, where we are all committed to leaving no one behind. For us, we don't want to leave any child behind because we believe that every child everywhere should benefit from the services that are available. And I would like to commend the government of Namibia for really ensuring that health and education are prioritized in the national budget. So it is us, development partners, UN agencies, to make sure that these services are available to young people. The government is very committed.